Colon cancer is a deadly disease that affects millions of people every year. It is important to know what it is and what causes it in order to prevent it and detect it early. Colon cancer, also known as colorectal cancer, is a type of cancer that starts in the colon or rectum. The colon is the large intestine and the rectum is the end of the large intestine that connects to the anus. Colon cancer usually starts as small, non-cancerous growths called polyps. Over time, some of these polyps can become cancerous. The exact cause of colon cancer is unknown, but there are several risk factors that can increase the chances of developing it. One of the main risk factors is age. Colon cancer is most common in people over 50 years old. Other risk factors include a family history of colon cancer, a history of inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, a diet high in red meat and processed foods, a lack of physical activity, obesity, smoking, and heavy alcohol consumption. In addition to these risk factors, there are also genetic factors that can increase the risk of developing colon cancer. Some people inherit gene mutations from their parents that increase their risk of developing the disease. These gene mutations are rare, but they can significantly increase the chances of developing colon cancer. In this video, we will look at the different early signs of colon cancer and how to prevent the disease. Before we look at these different signs and symptoms of colon cancer, please take a minute to like and subscribe to our channel. We appreciate your support as we grow a healthy and happy community. So, what are the signs and symptoms of cancer? Let's look at each carefully. Number 1. Changes in bowel habits. Bowel habits are an important part of our daily routine, and any changes in them can be a signal of an underlying health issue. Colon cancer is one such condition that can lead to changes in bowel habits. Let's now discuss the changes in bowel habits that can be indicative of colon cancer. Constipation or diarrhea. One of the most common changes in bowel habits associated with colon cancer is constipation or diarrhea. If you experience constipation or diarrhea that lasts for more than a few days, it is important to get checked by a doctor. These changes could be a sign of a blockage in your colon or rectum. Narrow stools. Another change in bowel habits that can indicate colon cancer is narrow stools. If you notice that your stools are thinner than usual, it could be a sign of a tumor in your colon. This is because the tumor can narrow the passage through which stool passes. Blood in stools. Blood in your stools is never a good sign. If you notice bright red blood or black, tarry stools, it is important to seek medical attention immediately. This could be a sign of colon cancer or other serious conditions like hemorrhoids or inflammatory bowel disease. Changes in bowel frequency. If you notice a sudden change in your bowel frequency, it could be a sign of colon cancer. This could mean that you are going to the bathroom more or less frequently than usual. Keep track of your bowel movements and talk to your doctor if you notice any changes. Feeling of incomplete evacuation. If you feel like you haven't completely evacuated your bowels after going to the bathroom, it could be a sign of colon cancer. This feeling of incomplete evacuation could be due to a tumor blocking the passage of stool. Number 2. Blood in your stool or rectal bleeding. Finding blood in your stool or experiencing rectal bleeding can be a scary and concerning experience. Many people immediately jump to the conclusion that they have colon cancer. While it is important to take these symptoms seriously and seek medical attention, there are other possible causes of rectal bleeding to consider as well. Colon cancer is one of the most concerning causes of rectal bleeding. The cancerous growths in the colon or rectum can cause bleeding as they grow and damage the surrounding tissue. If you experience any of these symptoms along with rectal bleeding, it is important to see a doctor as soon as possible. While colon cancer is a serious concern, there are other potential causes of rectal bleeding to consider as well. These can include hemorrhoids, swollen veins in the rectum or anus that can bleed during bowel movements. Anal fissures, small tears in the skin of the anus that can cause pain and bleeding. Inflammatory bowel disease, chronic inflammation in the digestive tract that can cause rectal bleeding, diarrhea, and abdominal pain. Diverticulitis, inflamed pouches in the colon that can cause bleeding, abdominal pain, and fever. If you experience rectal bleeding, it is important to see a doctor for a proper diagnosis. Your doctor may perform a physical exam, blood tests, or imaging tests to determine the cause of your symptoms. Treatment will depend on the underlying cause of the bleeding. For example, hemorrhoids may be treated with over-the-counter creams or surgery, while inflammatory bowel disease may require medication or surgery. While some causes of rectal bleeding cannot be prevented, there are steps you can take to reduce your risk. These include eating a healthy diet rich in fruits, vegetables, and fiber, exercising regularly to maintain a healthy weight, not smoking, getting screened for colon cancer regularly if you are over 50 or have a family history of the disease. Rectal bleeding can be a scary symptom to experience, but it is important to remember that there are many potential causes. If you experience rectal bleeding, it is important to see a doctor for a proper diagnosis and treatment. By taking steps to reduce your risk and getting screened for colon cancer regularly, you can help protect your health and prevent serious complications. Finding blood in your stool can be a scary experience, but it is one of the most crucial signs of potential colon cancer. If you notice any traces of blood in your stool or if you have rectal bleeding, it could indicate colon cancer. This symptom should never be ignored, and you should seek medical attention as soon as possible. 3. Abdominal pain or cramps. Abdominal pain and cramps are common symptoms of many medical conditions, including colon cancer. Colon cancer is a type of cancer that affects the large intestine, which is responsible for removing waste from the body. While abdominal pain and cramps can be caused by a variety of factors, it's important to be aware of the potential warning signs of colon cancer. Abdominal pain and cramps can be a warning sign of colon cancer, especially if they are persistent and occur in conjunction with other symptoms. Colon cancer can cause pain in the abdomen due to the presence of tumors or growths in the colon that can obstruct the passage of stool. This can cause discomfort, bloating, and cramping. If you experience persistent abdominal pain or cramps, it's important to see a doctor to rule out colon cancer as a potential cause. It's important to be aware of other symptoms of colon cancer and to take steps to reduce your risk of developing the disease. Number 4. Unexplained weight loss. Unexplained weight loss is a common symptom of colon cancer. While it can be caused by a variety of factors, if you experience significant weight loss without trying, it's important to talk to your doctor to rule out any serious underlying conditions. Weight loss is a common symptom of colon cancer because the tumor can cause a blockage in the colon, which can lead to a loss of appetite and difficulty eating. The body may also use more energy to fight cancer, which can cause weight loss. If you experience significant weight loss without trying, it's important to talk to your doctor to rule out any serious underlying conditions. Early detection and treatment of colon cancer can improve your chances of a successful outcome. Number 5. Iron deficiency anemia. Iron deficiency anemia is a condition in which your body doesn't produce enough red blood cells due to a lack of iron. Colon cancer can cause bleeding in the digestive tract, leading to iron deficiency anemia. If you experience shortness of breath, pale skin, and fatigue, you may have iron deficiency anemia. What are the different ways of diagnosing colon cancer? Colon cancer is a serious and potentially life-threatening disease that affects thousands of people every year. Early diagnosis and treatment are critical in improving the chances of survival. Colon cancer is typically diagnosed through a series of tests that evaluate the health of the colon and detect any abnormalities. Here are some of the tests that doctors may use to diagnose colon cancer. Colonoscopy. A colonoscopy is a procedure that allows doctors to examine the inside of the colon for any abnormalities or signs of cancer. During the procedure, A long, flexible tube with a camera on the end is inserted into the rectum and guided through the colon. Sigmoidoscopy. Similar to a colonoscopy, a sigmoidoscopy is a procedure that examines the lower part of the colon using a flexible tube with a camera on the end. This test is less invasive than a colonoscopy but may not detect cancer in the upper part of the colon. Stool test. A stool test is a simple and non-invasive way to check for colon cancer. The test looks for the presence of blood in the stool, which can be a sign of cancer. However, a positive result does not always mean cancer and may be caused by other factors such as hemorrhoids. CT scan. A CT scan is a type of imaging test that uses X-rays to create detailed images of the colon and other organs in the abdominal area. This test can help doctors detect any abnormalities or signs of cancer. Biopsy. If a suspicious area is found during a colonoscopy or sigmoidoscopy, a biopsy may be performed to remove a small sample of tissue for further testing. The tissue is analyzed under a microscope to determine if cancer cells are present. Although there are different risk factors that can cause colon cancer, there are also many steps you can take to prevent it. Here are some tips that can help you reduce your risk of developing colon cancer. Get screened regularly. One of the best ways to prevent colon cancer is to get screened regularly. This will allow doctors to check for any abnormal growths or polyps in the colon and remove them before they turn cancerous. The recommended age to start screening varies depending on different risk factors, so talk to your doctor to determine when you should start getting screened and how often. Maintain a healthy diet. Eating a healthy diet can also help reduce your risk of developing colon cancer. Make sure to eat plenty of fruits, vegetables, and whole grains, and limit your intake of red and processed meats. You should also avoid foods that are high in saturated and trans fats and limit your alcohol intake. Exercise regularly. Maintaining a regular exercise routine can also help prevent colon cancer. Exercise can help you maintain a healthy weight and reduce inflammation in the body, both of which can lower your risk of developing cancer. Aim for at least 30 minutes of moderate exercise most days of the week. Quit smoking. Smoking is a well-known risk factor for many different types of cancer, including colon cancer. If you are a smoker, quitting smoking can be one of the best things you can do to reduce your risk of developing colon cancer and many other health problems. Manage your weight. Being overweight or obese can also increase your risk of developing colon cancer. To manage your weight and reduce your risk of cancer, try to maintain a healthy diet and exercise regularly. Be aware of your family history. If you have a family history of colon cancer or other types of cancer, you may be at a higher risk of developing cancer yourself. Talk to your doctor about your family history and any genetic testing that might be appropriate for you. As we conclude, colon cancer is a serious condition that can be prevented and treated if detected early. You should always pay attention to your body and look out for the early warning signs of colon cancer. If you notice any of the symptoms mentioned in this article, do not hesitate to speak to your doctor immediately. Remember, early detection is the key to preventing colon cancer from becoming a life-threatening illness. Preventing colon cancer requires some effort and commitment. By following a healthy diet, exercising regularly, quitting smoking, and getting screened regularly, you can lower your risk of developing colon cancer and improve your overall health and well-being. Remember to talk to your doctor about any specific recommendations for preventing colon cancer based on your personal risk factors. Goodbye for now, and see you in our next video.